Hello everyone, how are you today? I hope you're fine. Before we start our topic today, I want you to subscribe to my channel and hit the notification bell. Today we are going to explain the advantages and disadvantages of implants and dentures. So let's start off now with dentures. What is a denture? A complete denture is a removable appliance used when all teeth within a jawbone have been lost and need to be prosthetically replaced. In contrast to a partial denture, a complete denture is constructed when there are no more teeth left in the arch, and hence it is exclusively tissue supported prosthesis. So here we have, this is the denture base, okay. This is a complete denture. We have upper and lower jaw, okay, upper and lower jaw bases, okay. It's used for patients who are edentulous. They don't have any teeth at all, okay. And this one we call it a denture base. This is another patient who has who's partially edentulous. He has some teeth and some teeth are absent. So for this case we use the partial denture for this patient. Here there are three types of denture. We have complete denture, which is used for edentulous, completely edentulous, partial denture for partially edentulous patient, and implant supported denture here for used for parts of also maybe one arch is absent, the teeth are absent, okay. This is also a partial denture, okay. Here we have these, we call them clasps, which are supported on the natural teeth, okay. And it is removable. You remove it and you clean it, and it's removed at night before you sleep. Let's say now talk about the advantages of denture and the disadvantages. The advantages of denture: they are less costly, there is no surgery, it's just a prosthesis that you put it in your mouth and you remove it. The disadvantages of a denture: it's not fixed prosthesis, must be removed at night, may be unstable and unretentive, may not be tolerated if the patient has a gag reflex. So if patients with gagging reflex, this would be really difficult for them to wear. Bone will be resorbed with time, okay, because of this, the force on the jaw, and these appliances are placed on the jaw directly, so this may lead to resorption of bone. So now we talked about the advantages and disadvantages of denture. Let's go into an implant. The advantages: we're going to talk about an implant. What is an implant? An implant is a surgical component that interferes with the bone of the jaw to support a dental prosthesis such as a crown, bridge, denture, to act as a prosthodontic anchor, okay. So this is the definition of an implant. Can you see it's placed in the jaw bone, and it needs a well established jawbone. Can you see this patient here? There is an extracted tooth, okay. So the doctor recommended for him to make an implant. So he placed the implants here, okay, in this space, okay, and then he made the lateral and he placed the crown, okay. So this is before and this is after. Can you see how beautiful the smile looks after making an implant? That's why it's more expensive than dentures. This is the appearance, this is the structure of the implant. Here the porcelain crown and implant, and this is the jawbone. Okay, in comparing it to the natural tooth, it's almost the same shape. Natural tooth crown, and this is the natural roots, and then we have the gum, and this is the jawbone. Okay, so and the implant looks like a screw. Can you see? It looks like a screw. Here this is another implant. Okay, this is for the lateral. Okay, and he made an implant here. Can you see how beautiful it looks here? It really looks nice. It looks beautiful. Let's know now the advantages and disadvantages of implants. The advantages of implants: they will provide a stable prosthesis, can be fixed or removable, can be tolerated by patients with a gag reflex. So patients with gagging reflex, this would be a good choice for them. Maintaining supporting bone. Disadvantages of implants: surgical disadvantages. It's a surgical procedure, takes longer to proceed from start to finish than a denture. It's more expensive. Maintenance requirements: must have adequate bone and so may need a bone graft. There is poor, but the very bad disadvantage: poor prognosis in people or patients with diabetes, and poor prognosis in smokers. So poor prognosis with the diabetes and smokers. Okay, let's see here. Diabetes has a loss of periodontal attachment occurs more frequently in people with moderate to poorly controlled diabetes, type 1 or type 2, than in those with better control. Diabetic patients with more advanced systemic complications have greater frequency and severity of periodontal disease. Although implants do not have a periodontal ligament, they are still subject to peri-implantitis, and as such there is a greater risk in a diabetic patient. The better controlled diabetes, the better the prognosis. Okay, so I hope that you enjoyed today's lesson, and it was of great benefit to you. And today we discussed and explained the advantages and disadvantages of implants and dentures, and we know now the differences between them both. Okay, I hope that you have a good day, and goodbye for now.